Hey there, it's Huang Tran with Hand Therapy Secrets in collaboration with the Note Ninjas. Now, they're having a summit and they asked me to put together something for them, just for them, in terms of documenting within the hand therapy space and also to be able to answer some of your most pressing questions as it pertains to hand and arm types of issues, no matter what setting you work in. So, again, my name is Huang Tran. I am an occupational therapist and certified hand therapist, and my goal with Hand Therapy Secrets is really just empowering therapists to develop your clinical skills as it pertains to hand and upper extremities so that you can have more choices in your career. So I think hand therapy is so important no matter what setting. So just because I currently work in outpatient and I have my own therapy clinic right now, it doesn't mean that's the only space and the only place that we help people with hand and arm injuries. I did skilled nursing. I've done a little bit of home health even, or private care in someone's home. And I've worked in an acute care. I've worked with kids. So I've kind of run the gamut of it. And I really strongly believe that if you're lucky, you have 2 hands and 2 arms and someone out there needs your help. And you know what? If they're missing a limb, even more help that they need from you, right? So what I'm going to do first is I'm going to go into the 3 principles I have when it comes to documenting. I'm going to give you some examples, and then towards the end I'm going to share with you some pressing questions that the ladies shared with me that you guys have questions. So hopefully this helps you. And if you want to know more about hand therapy and how I can help you, the ladies will share the links in my courses, but you can look me up, Hand Therapy Secrets, pretty much across the board. You'll be able to find me on every social media channel, TikTok, Instagram. I'm on Instagram a lot, so join me there if you like. Facebook, I'm on YouTube. Subscribe to my YouTube channel, right? So yeah, let's get started. So when it comes to documenting, remember these 3 principles. If I do any editing, I'm gonna leave it right here for you, okay? Understand that documenting is about covering your ass. Keep it short and sweet. That's number 2. And number 3, really understand and know who and why you're documenting, because that's going to be really important. So think about what you need to do to cover your butt, right? What did you do in that time that you were spending with them, and then how did they respond? So if you think about Soap Note, right? So I still use Soap Notes, and I remember learning this stuff in school, right? So SOAP. So if you think about subject is, how are they coming in today? What are they saying? So if you're in acute care, you can say whatever, patient painful, patient stable, feels good today, patient stable for therapy, blah, 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 right? This is objective. This is what you did with them, right? This is what did you do. So this is what you did in therapy. So in a skilled nursing facility, if I did any kind of active range of motion and passive range of motion, if I did any ADLs with them. So for example, if I did passive range of motion, active range of motion of all hand and upper extremity so that we could participate in ADLs, right? Then that's what you write. That's what you did, right? And A, most important, is how they responded. Patient, their response, right? Their response. How did they deal with your therapy? So, for example, if you work in a skilled nursing facility, you might have some patients that have CMC arthritis, they have a lot of pain in their thumb. So if you were to incorporate a few manual therapy techniques, right, you included some passive range of motion, then you could say that, provided joint mobilization to bilateral CMC or thumb range of motion, provided manual therapy joint mobilizations to bilateral thumbs for pain and range of motion. And then you could say, practice ADLs, right? Practice dressing, bathing, blah, 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 right? And then patient responded well, That's all you got. Patient responded well to the manual therapy treatment, to the passive range of motion, active range of motion, which then allowed patient to be able to complete ADLs with Mini-Assist. I mean, it's that simple. Just document what you did and how they responded. Now, that's covering your butt. No one ever comes to you when you're doing good, right? No one ever comes for you when you're doing good. The whole point of documentation is you know they're coming for you if something goes wrong. So cover your butt. Manual therapy, blah, 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 ADLs, patient responded well. And then if they go and say, oh, well, she did X, Y, and Z, and now I have more pain, well, great. You know what? They did really well right in that moment. Now, if they have more pain, we just have to modify and adjust our therapy. Maybe that was a little too much. Maybe we got so much motion that she had more pain. So then we'll just modify a little bit of the treatment the next visit. Thank you so much, patient, for telling me you have more pain. Next day, patient reports more pain from, last session, ADL session, right? So then you'll do something different. Modified treatment so patient was able to tolerate more, ask more questions, anything like that. So that's a skilled nursing facility. You can do that in acute care. You can do the same thing in acute care. Now, acute care is just like more rapid, right? It's just like faster pace. Outpatient is a little bit in between, depending on what kind of setting you work, what kind of patient population you have. But really, at the end of the day, number one, cover your butt. It's always, when things are great, but when things are bad, you really want to make sure that it is documented somewhere. I had one instance, on my 25 years, I had one instance where the patient came late, said, he had XYZ problem, right? It was a shoulder problem, said he had pain. I palpated his shoulder, so I palpated his rotator cuff. You don't have to know specific. Palpated his rotator cuff around the inside of his armpit, right? I was looking for the subscapularis, and he reported pain with palpation. So what I did was I checked the other side, because technically speaking, that's what you're supposed to do. If you have pain on one side and you have pain on the other side and they're the same, is that really the problem, or you just came in like that, right? So I palpated both sides and both sides were equally painful. I documented that, right? Patient, presents with, pain, whatever, check the other side, pain with palpation on both sides. Discuss with patient what we need to do in therapy to address. Patient agreed. Listen, he went to my manager. No, he didn't go to my supervisor. He didn't go to my manager. He went to the director of rehab and complained about me. And I was like, bring it on, because I know I documented to cover my butt. Number one. Number two, let's keep it short and sweet, because documentation is unpaid time. We don't have all day. We're not here working for free, okay? So we don't get paid for that. So this is why it's so important, so that you could write what you need, but not spend all day. So this takes a lot of work and a lot of practice, so that you're not feeling like you are constantly going home and spending 2 or 3 hours, documenting. The way I see it is, if you're documenting for 2 to 3 hours afterwards, then there is something wrong with your time management. Now hold on, don't get upset with me. Don't get upset. I tell this to my therapist. I have told this to my friends. If you're struggling with documenting, it's taking you a really long time, the only person that you could blame, right, that could make any change is yourself. You can blame the system, you can blame the hospital, you can blame whatever, but you cannot control outside forces. You can only control what you do. So when you can control what you do, it allows you to be more empowered, right? And so the whole point is empowering you, right? Because we can't do anything about the hospital system. We can't do anything about the insurance system. So you have to think about what you can do so that you can keep it short and sweet. In order to keep it short and sweet, we're going into our third, right? Our third is know who and why. Know who and why you're documenting. Who are you documenting for? Who and why, right? Who and why? So I'm a mostly cash-based therapy clinic, but we do workers' comp. So if you think about workers' comp is just like any other insurance. If you work in acute care, skilled nursing, home health, especially home health, that's why you get paid a little bit, like a lot more in home health, because the documentation time takes so long. So it kind of grades for that versus someone at that in the driving and stuff like that. So, but just think about who you're documenting for and why. So I'm going to use workers' comp, right? Because my cash paying patients, I just have to justify to them. So if I'm getting them results, that's the only person I have to worry about. If they want to keep paying me, they pay me. Here's your credit card, that kind of stuff. So who? If it's insurance, then why is justification. Justification. I don't know if you know, but I'm not a very good speller, but I'm still successful. Who would have thought? So who is the insurance? It could be the insurance. It could be your program, right? Could be your, like a rehab center. Personally, my in-laws have been going in and out of rehab for a lot of medical issues and rehab needs. And so when we think about who we're justifying it to, yes, it's insurance, but it's the rehab center. It's their, the other therapists, the team of people who then have to justify to say this person needs more, give me more money to have this person stay in here, right? So when you think about that and you think about how what's important. So here in a workers' comp world, the whole who and why is they need to get back to work. People need to get back to work. So we're always justifying for return to work. All of my treatment, all of my documentation, right? Maybe not my treatment, all of my documentation is to justify them getting more authorization. I'm asking the insurance company, pay me, because I'm gonna get this person back to work. So to simplify, you're talking to your team in an inpatient rehab. This person, I am doing X, Y, and Z because this person told me that he lived alone before, he was independent with driving, independent with ADLs, and he had a stroke, right? I need to tell everyone in that team from an OT perspective, hey, as an occupational therapist, this person is, was completely independent with dressing, shower, and right now, because of his stroke and because of his arm, he needs meniscus, he needs more therapy. I'm going to provide therapy for his arm. I'm going to incorporate his arm stuff into ADLs, right? And I'm going to get him back to independent. And that's why return home. Return home with as minimal help as possible. This is what happened to my own family, right? So this is what we're doing, right? So, think about that. And if you can think about that and you can keep that top of mind for every single note, you will be able to write your notes short and sweet, right? Short and sweet, which equals to less time. We're not trying to be out here writing a book, right? We're not trying to be out here writing a chapter. So you really have to think about how can you summarize in a very condensed way, but that will cover your butt and will also be able to justify all of your needs. So those are my 3 main principles inside of my programs. So inside of the mentorship program that I run, we have a whole module on documentation examples and things like that, and a whole framework that I teach my students when it comes to documenting for hand and upper extremity types of issues. I always bring it back to function, right? If you're a physical therapist, what's the function? Well, for my father-in-law, it was being able to, walk, being able to move his leg, being able to get in and out of the car, being able to walk a certain amount of distance with less compensation, right? Well, first he was like a max times 2 at the beginning, like he was like pushing to one side. Anyway, so, just kind of keep that stuff in mind, what you're trying to do, what you're trying to justify for. But yeah, inside my programs, I have a more complete, detailed framework and stuff like that. If you're someone who's interested in developing more of your skills in hand therapy, the Note Ninjas will share with you the links that you can look into. I host live courses as well. I have a 2-day manual therapy course that I teach. And in all my courses, I talk about documentation. In all my courses, I include documentation and billing because it's so important. If we want to get paid as therapists, I don't care if you're an OT, PT, OT assistant, PT assistant, it really doesn't matter. We're a licensed professional, and the way we get paid is through billable time, right? It's through billable time. You have to bill your time and in order to get paid. So if you're working for someone else, like my staff, in order for me to pay you, you bill correctly and document it correctly so that we can get the money, the revenue to come in so we can all make a salary, right? So, and then with our salary, we're going to be able to develop more and more of our skills and be able to help more and more people. So that's my framework. Let's go dive into a few questions that I have. So let's go into the first question. What are the most effective treatment strategies for improving hand strength and coordination in patients with arthritis and post-surgical? Well, that's a big question. The most effective treatment strategies for improving hand strength and coordination with patients with arthritis and post-surgical, right, is really at the end of the day, you have to have range of motion in order to have any strength or coordination. So if your patient's like this, I can't move my hands, then putting a ball in it is not going to help you get more motion or get more strength. Majority of the time, people have lost motion, and that's why they don't have strength, right? And so you've got to work on gaining more motion in order to be able to work with strength, right? And then coordination, they're two separate kind of problems. And then at some point you merge them together as they get more motion, right? So as they get more motion, then you can start to do more coordination types of things. But coordination is a whole upper extremity thing. So if your hand has no coordination, you're trying to get them to move and do stuff, and you're only focused on their fingers, well, you're not going to get anywhere fast. You have to make sure that you're working on the whole shoulder to get range of motion, to get strength, and then you test for coordination. Then you can be like, oh, if I work on range of motion and I work on a certain amount of strength, will they be able to have more coordination, right? So you can do some of that instead of, so the way I describe it is thinking big and then going small, being able to have a flexibility to look above and then to go into the details of it. Let me know if that helps. How can I document skilled interventions for hand therapy to ensure proper reimbursement and demonstrate medical necessity? Did I not just give you a ton of examples of that? Here's the thing, is that you have to provide it, you have to do it. Like, so if you provide manual therapy, right? So provided manual therapy for joint mobilization. So I'm going to say like thumb CMC. Thumb CMC is like everyone's like stuck in their palm. So you are doing a dorsal, right? Let's not get fancy. I'm bringing the thumb out of the palm. I'm working on thumb abduction, right? Thumb abduction, passive range of motion, joint mobilizations, and then you pair it with, doing some gripping, doing some grabbing, doing some ADLs. And then you document that you did that and that they got better, or that they had less pain, or that they felt that it was easier, right? So remember, therapy treatments are one on top of another. It's not like you do something and then all of a sudden, magically they got better. Majority of the time, they need a little bit more time and help, depending on your patient population age. Okay, keep that in mind. Okay, Third question, what are some creative activities that I can use to address fine motor skills and grip strength for older adults or pediatric patients? So I'm going to address this for older adults. I think with pediatrics, like a whole nother genre of activities that you can do. But what are creative activities that I can use to address fine motor skills for adults? Here's the thing with getting fine motor coordination with your patients. These are adults you're working with, and especially as an occupational therapist, we want to, I know that we want to have this whole creativity thing, but we can be creative without making our patients feel small and childish, right? So you've got to know your person. So I think that when you're working to improve fine motor activities and grip strength, always take it back to what is it that they need, and then that way you can work with it. Let me pause this video and go get something real quick. Okay, I'm back and I brought a couple of things, all right? I hope that you can see it. Let's see if you can see it. So, you don't have to be that creative. And do you know why you don't have to be that creative? It's because at the end of the day, one, you're getting new patients over and over, right? So if you do the same thing over and over, you're gonna get better with exercise selection based on your patient's needs. The other thing is that the thing that you're looking to do, right? Fine motor coordination, because you want them to be able to do what? Button their button, have more range of motion, have more grip strength, right? Then we got to make sure that we're addressing that. So if they don't have enough range of motion and you're working on a bunch of fine motor skills that don't give them range of motion, then you're not getting the results. So it's not that you need more creative shit, you just need more results, right? So range of motion of hands, thumbs, wrists are going to be really important so that they can actually do more. I think that we spend a lot of time in working into flexion just because we think that they need to be able to make a fist and to be able to have more grip strength. But you cannot have grip strength without extension, and you cannot have grip strength without wrists, like good wrist motion, and you cannot have good grip strength without more proximal stability and strength, right? So again, I want to encourage you to think a little bit more grander or outside of the box, and then you can hone into some of the details. So some fine motor stuff is really like, I'm sure you've seen some of this, right? But you have to have really good thumb to do this, right? So not everyone's a really good candidate for this, but when you're really good, you can roll it around without making any noise and without compensating, right? So some of your patients might be really good or be really good candidates for this type of thing. You don't have to just have these metal balls. You can do anything. Crumble up some paper and move that shit around. That's in-hand translation, right? Am I saying that correctly? So I use marbles. So I usually dump it out on a towel and then I'll have them do big grips. Like, so if they're lacking motion and I'm trying to get more motion, I will work on grip strength. Did I? Oh, not grip strength, but trying to get that rake, right? And different sizes help. So I have sponges, like I have bigger pieces, and then I have I just I don't know, got this at the craft store. And then I have smaller, slipperier pieces, and you can make them tear some paper, crumble it up, and do the same thing, right? So fine motor coordination is just, there's gripping, there's just random, grabbing, right? What am I trying to say? And then there's also things like one at a time, right? One at a time. And then they have to hold and put in their hand, hold and put it in their hand. If you do an activity analysis, I know, going back to school, you'll see that I have to supinate and I have to pronate. You see that I have to move my wrist a little bit, and my thumb and my fingers have to move independently of each other. And then you can also do it where you make them pull from their palm. So there's some translation there too. And then put it in here like that and do it one at a time. There's so many different things. The thing that is most important is that you have to find the activity that your patient has a hard time doing but can still complete the task. So you don't want to find an activity that they are failing at, right? Because then it's too hard and it's depressing. If it's too easy, they think you're stupid. Let me be honest. They think you're ineffective and they think whatever you're doing is crap. So I know nobody's saying it, but I promise you somebody's thinking it, right? Pay attention, it's coming out somewhere. The other thing I like to do is don't just work into flexion. I'm a big believer in working into extension. People love using putty, but you can use a scrunchie or a rubber band. And this is a really thick one just because I have patients that are pretty strong. If you watch me on social media or anything like that, sometimes I have these pictures like this. It's because I'm trying to get my patients to go and it's opening their fingers, but it's not just opening their fingers, it's actually working on, stretching the little muscles that are inside your hand that are called intrinsic muscles. So they can just open up like this. I have freakishly mobile fingers, but they can just open like regular, or they can go like this, and this is more advanced. So when it comes to exercises, you have to find more basic and then be able to graduate your patients little bit by little bit into a harder activity that will advance them. Let me know if that helps. Now we're going to go into the next question. All right, question number 4. How do I incorporate functional goals into hand therapy, such as improving ADL performance like buttoning and utensil use? Well, I do everything going back to function or going back to whatever it is that they want to do. So you have to have that goal, and then everything you do has to go back to that goal. So I'm going to give you an example. I get patients that are, obviously I get patients that are in outpatient, a lot of times more higher level. So I had a patient who came in, doesn't have like a ton of pain, but he has pain when he writes. So he's like, I love journaling and I write for hours at a time. And I've been noticing that my hand hurts after just 30 minutes, right? So part of your job as an occupational therapist or physical therapist is to really figure out the root cause. What is causing that problem that they can't, write for 30. Now he can write, he just can't write for longer. So then I am working on his shoulder, his elbow, his wrist, his hand to solve that problem. And then my goal is for him to write for an hour, 2 hours, 3 hours without any pain. In an outpatient setting, I might do the exercises, but then the function isn't that I'm going to sit there and write with him. He don't need me to sit there and write with him. But what I will do is if I did some shoulder exercises and I did some weight bearing exercises or things like that, I'm going to bring him back to the table and I'm going to be like, write your name. Does it hurt less? Does your hand shake less? And then that's how I would document it. And then when he comes back, the homework I'm giving him, it's not like sit there and write. He's already writing. So what I want you to do is tell me how long. So you got to monitor yourself. So part of your job is to educate your patients on what to do, what to monitor to bring it back to you. So I told him, when you go home and you write, I don't care when you do it, I want you to turn the timer on, monitor at what point did you start feeling this, right? And then monitor the symptoms of what it was, so then we can work together. So you can't be with your patients all the time. You just have to know how to ask them what to do so they can bring back to you the most pertinent information, right? There can be, let me see, my father, I'll give you an example. My mother-in-law, she is, they're almost 80. She's overweight, she has arthritis, she had carpal tunnel releases, right? So her job, her problem was buttons, right? Her problem was buttons. And so if I were to go and do some range of motion and then I did buttons with her, or if I did scar massage and range of motion, tendon glide exercises with her, and then I was like, oh, let's do this fine motor activity. How did it feel? Oh, here's the thing. You can try a few fine motor stuff and then do the treatment and then go back to doing the fine motor activity and saying, how does that feel now? Is it easier? Is it better? Is it less painful? And that's how you know that you're making some improvements in that one session, or you just might need to follow up in other sessions, because some people just need more time before you can see improvement, right? So that's how I do it. What are the last question, number 5, last questions. What are the best ways to address sensory deficits such as hypersensitivity or numbness during hand therapy sessions? And so, all right, probably one of my favorite topics, nerve issues. So if it depends on why you have the hypersensitivity and numbness, right? Why is so important, because if you're not addressing the right area, then you are not going to be effective, and that doesn't really feel good, right? So if you cut your finger or you had surgery and they're hypersensitive where that scar is, then that's where that scar is, and you could be effective in your treatment by doing massage, doing sensory integration stuff. I don't know, like, oh look, my little mic, like rub it with some cotton balls, rub it on some jeans, anything like that to then reduce the hypersensitivity. If you have hypersensitivity at the tips, or you have numbness at the tips, and it is because it's coming from somewhere else, and you're sitting here, you're rubbing on the tips, that will not help. So the best way to address sensory deficits is actually to know how to address the root cause of the problem. You have to get to the root cause of the problem in order to address those types of problems effectively. So I'm going to give you an example. If you have, I'm going to give you an example of my mother-in-law. She has had carpal tunnel for years and finally decided to have carpal tunnel surgery, right? She is diabetic, so she has a certain amount of neuropathy already. So she has a certain amount of numbness due to time, disease process, and now her surgery, right? Her surgery didn't make it worse. Her surgery made it better. So her residual numbness will get better over time as long as I work on range of motion of her fingers, range of motion of her wrist, if I'm doing nerve glides, moving all the nerves, and I massage the scar. But numbness is one of the last things to go away, and it won't go away for good if you've been compressing it for decades, right? So again, you have to know your root cause. If someone has if someone has diabetic neuropathy, we're not working on sensation. Why? You can't change it. Because when something dies, you can't bring it back. Like, we're not Pet Cemetery. Oh my God, did I just age myself? So you have to understand the root cause, you have to understand what you can affect and what you can't affect, so that you can work more effectively. But also, I'm a big believer in working with less frustration. I'm not going to work on things that can't change, right? If she has diabetic neuropathy, right, I can't change that. This woman has been, diabetic for over 30 years, and it has been progressively getting worse. So my goal isn't to address numbness. It's to address, is that tendon moving through? Does she have better range of motion? Can she pick things up better with her eyesight, using it to help her with sensation? Does she know sensory safety types of issues if she has a certain amount of numbness, like protective types of sensation, right? If I know that, then I know I'll work on the right things and not put my focus on things that won't make a big difference in someone's lives, right? And then you have to have that tough conversation with your patients, because you have to manage their expectations, especially in order to justify and in order to, justify, but also in order to, be able to, hit those goals that you want, right? So I hope these sample questions really give you an insight into hand therapy and into what is totally possible for you as a therapist in the realm of hands. I just recently had a patient of mine who he had a whole left side type of issue, and people thought he had a stroke, but he didn't. And so many times the hand and upper extremity is ignored because people say, oh, the hand's so hard, it's so intricate, and so they kind of like brush it off. This guy has been living with his problem for 2 years. I've worked with people with strokes. I've worked with people post-surgical hands, like the gamut, right? For the most part, majority of the people out in the world, they have 2 hands and 2 arms, and they need your help. We have to dispel the idea that hand therapy is too hard, and we have to dispel the myth that hand therapy only belongs to certified hand therapists. Every therapist who works with people with 2 hands and 2 arms, you have the possibility of being a hand therapist. You can be their hand therapist. You can be effective with your treatments for their hand and arm problems. You can help them with their hand and arm problems so they can do X, Y, Z, whatever it is. So hand therapy isn't just for certified hand therapists. Now, if you want to become a certified hand therapist, I'm your girl. I can help get you there, right? But I don't think everyone needs to become a certified hand therapist. I think if that's what you want, go for it, right? Don't let fear stop you. But if you love being a therapist, want to get better at it, then you owe it to yourself and you owe it to your patients to learn more about hand and upper extremity therapy and how you can be effective with them. So I hope you enjoyed this session, and I hope you enjoy the rest of the summit. If you need me, look for Hoang Tran at Hand Therapy Secrets. All right, I hope to see you in one of my courses.